Hello friends, let us now learn about one more previous year question in AIMS. So, compliance curve of the lung given below. Curve A signifies what? So, this is the normal TLC. In this curve here, you will see that the total lung capacity is increased. Okay, at a particular transpulmonary pressure, you will see that the total lung capacity is increased. So actually, what is this graph? This graph is a graph of compliance, that is change in the volume by change in pressure is the compliance. So here the in A graph compliance is increased. Increased compliance or increased lung volume is seen in emphysema. In emphysema, you will see increased lung volume and increased compliance is seen. Thank you for watching.